Good morning. My name is Gillian Barnes, and I am president of the Canadian Association of Speech-Language Pathologists and Audiologists, better known as CASLPA. Joining me today is audiologist Dr. Andrée Durieux-Smith, Associate Vice President, Research at the Montfort Hospital. With over 5,500 members, CASLPA is the national body that supports and represents the professional needs of speech-language pathologists, audiologists, and supportive personnel. Through this support, CASLPA champions the needs of people with hearing and communication disorders. It is in this champion capacity that CASLPA is here today to launch its position paper on universal newborn hearing screening as part of a national campaign to improve the early identification of hearing loss in children. We are calling for the Canada-wide adoption of universal newborn hearing screening, or UNHS programs, in all provinces and territories. UNHS programs use an inexpensive and non-invasive test that quickly and accurately screens for permanent childhood hearing loss in newborns. The screening process is simple and should be performed before a newborn leaves the hospital. At about $35 per test, such screening is less expensive than a number of other current newborn screening tests. Undetected hearing loss has been described by some researchers as a neurologic emergency. Hearing and communication is critical to the foundation of a child's development, and any impairment has a cascading effect on all other elements. Extended periods of auditory deprivation have a significant impact on a child's overall brain development and sensory integration. Deficits in speech, language, cognitive, academic, social, and emotional development are the expected results of untreated hearing loss. The most direct way of limiting the impact of these factors is to reduce the age in which hearing loss is identified and start intervention as early as possible. CASLPA, along with the Joint Committee on Infant Hearing Screening in the U.S., the American Academy of Pediatrics, and the National Institutes of Health, recommend that UNHS programs be designed so that initial screening is conducted by 1 month of age, confirmation of hearing loss by 3 months of age, and intervention beginning by 6 months of age. The key is early identification leading to early intervention. UNHS is the first step in this process to improve developmental outcomes, including social, educational, and cognitive abilities in children with hearing loss. This is obviously a direct benefit to affected children, but is also of great benefit to the education and health systems. Remember, early intervention manages impairments in a fashion that is often more direct and less expensive, ensuring that challenges don't become major problems. Historically, only those babies with high risk factors have been screened for permanent childhood hearing loss, but studies estimate that nearly 50% of infants with hearing loss have no such high risk factors. High risk factors can include family history of hearing loss, prematurity, or low birth rate. Since it is more difficult to detect permanent childhood hearing loss based on observation alone, the absence of UNHS programs inevitably delays the identification of affected children with no risk factors until as late as 3.5 years of age. It is unacceptable to limit access to newborn hearing screening based on a screening regime that misses such a large portion of the affected population. Luckily, UNHS is increasingly becoming the standard of care in many developed countries, including the United States and the United Kingdom. In the United States, 95% of newborns are screened with the UNHS program. Ontario and New Brunswick were the first provinces to introduce mandated UNHS programs in Canada in 2002, and since then there has been a growth in the number of programs across the country. Despite this growth, UNHS programs remain non-existent in some areas of Canada, and this is cause for significant concern as not all Canadian children have equal access. In jurisdictions with UNHS programs, babies have ready access to tests that screen for hearing loss quickly and painlessly, setting them immediately on a path for intervention if needed and minimizing the negative consequences associated with undetected permanent childhood hearing loss. In those jurisdictions without UNHS programs, identification of such impairments is delayed, often significantly, meaning that children face increased challenges socially, academically, and behaviorally. All children in Canada, regardless of the area in which they live, deserve equal access to newborn hearing screening programs, which could ultimately have a significant and positive effect on their lives.